Hello, this is Shin Jae Kim from Wooridul Spine Hospital. At Wooridul Spine Hospital, we often use artificial ligaments made of PET in spinal ligament reconstruction surgery. I would like to briefly explain why this material was chosen. When inserting a foreign material into the body, the most important consideration is to minimize immune rejection and avoid complications such as infection. Of course, the risk of infection can never be completely eliminated. Since each person's immune system is different, a material that is safe for most patients may still cause reactions in a few cases. PET has long been used in orthopedic surgeries for the knee and shoulder before it was applied to the spine. Its safety has already been proven in these fields, so we adapted it for spinal procedures. In fact, orthopedic joint surgeries are often more prone to infection than neurosurgical procedures. Yet PET has been safely used there, which strongly supports its infection-related safety. In simple terms, although ligament reconstruction is a medical procedure, the posterior ligament that supports the spinal bones is inevitably removed during surgery to access the spine and decompress nerves. We replace it by looping a PET artificial ligament between the spinous processes in the posterior spine. Then, a single transverse loop is placed through the space between the spinous processes. This design has steadily evolved since the early 2000s into its current form, optimized to replicate the function of the body's natural ligaments. PET is not only resistant to infection. To function effectively as a ligament substitute, it must have the right balance of strength and elasticity so it can move naturally with the body, as well as excellent durability, so it does not wear out or degrade over time. Considering all these properties, PET is one of the most suitable materials for artificial ligaments. The ligament also has microscopic pores that are not visible to the naked eye. About 3 to 4 months after surgery, muscles and other tissues grow into these tiny gaps, leading to secure biological integration with the ligament. When examining it at that stage, we can observe that it supports the posterior spinal structures much more firmly than it did immediately after surgery. This strong engraftment is another advantage of PET. One group of patients who can benefit greatly from spinal ligament reconstruction is elderly individuals with multi-level spinal stenosis. Many of them come to us in severe pain after being told by other hospitals that surgery is not an option and that they should just continue with conservative treatment, especially because they cannot have pins implanted. While spinal ligament reconstruction is entirely different from fusion surgery that replaces anteriorly degenerated discs, it is an excellent alternative for older patients with severe osteoporosis and multi-segment stenosis who are not candidates for spinal fusion. Although it does not replace the discs, it reinforces the unstable posterior structures to a certain extent, providing added support and stability. In short, for elderly patients with multi-level stenosis, this is one of the most beneficial surgical options available. Spinal ligament reconstruction is not a treatment we created overnight. It is the result of many years of dedicated research and refinement. As with all surgeries, whether spinal fusion, minimally invasive endoscopic surgery, or even simple disc procedures, there is always a risk of infection. However, the actual incidence in spinal ligament reconstruction is very low. An occasional postoperative infection does not mean the surgical approach itself is flawed. Statistically, it is a safe and reliable option, and I hope it will not be judged negatively based on isolated adverse events.